People's Hospital and team leader of psychological intervention for COVID-19 response in Hubei, Mr. Liu Zhongchun, Director of Respiratory and ICU Department of Wuhan Zhongnan Hospital, as well as the member of the Wuhan Commission for Respiratory Medicine, Cheng Zhenshun, and Vice President of Hubei TCM and Western Medicine, Mr. Xia Wenguang. Deputy DG of the Hubei CDC, Mr. Li Yang. First of all, I'd like to give the floor to Mr. Li Yang to brief us the latest development of COVID-19. As of 24 o'clock, April the 24th, the cumulative confirmed cases of COVID-19 in Hubei reached 68,128, among which 50,333 in Wuhan, in other cities 17,795. On April the 24th, from 0 to 24 o'clock, Hubei Province has reported 0 new confirmed case. There's no imported case. In the province, for 21 days in a row, has reported 0 new confirmed cases. In other regions out of Wuhan, in the province, for 51 days, reported 0 new confirmed cases. As of April the 24th, we still have 23 patients hospitalized, among which 0 in severe conditions and 0 in critical conditions. As of April the 24th, the accumulated fatal cases reached 4,512. On April the 24th, we have reported no new fatal case. As of April the 24th, the accumulative discharged cases numbered 63,593. On April the 24th, we have newly discharged 24 cases from hospital, all of them in Wuhan. On April the 24th, the number of newly added asymptomatic cases was 20. Number of them developed into confirmed cases, and we have removed 11 cases from quarantine. We still have 553 asymptomatic cases under medical observation. Now I'd like to give the floor to Mr. Liu Zhongchun to talk about the progress made in the psychological crisis intervention for the COVID-19 response. Good afternoon, everyone. Let me talk about this intervention. Under the leadership of the headquarters, we have set up this team of psychological intervention crisis response. We have a commission composed of experts and also the scholars as well as students. Together, we have formed a synergy in the psychological crisis intervention. For people that have participated in this work, we have together elaborated a plan for the psychological crisis intervention and also the principles for the assistance for the mental health. This work is quite different from what we practice in normal days, because after being attacked by COVID-19, the patients may develop different psychological problems. So in this professional team, we'd like to use our professional knowledge to stabilize the mental status of our patients so that we can minimize the impact in the mental aspect to their treatment. First of all, in the makeshift hospital and designated hospitals, we have set up the psychological crisis intervention teams. Our experts and the scholars have visited those makeshift hospitals and designated hospitals for many times so that we can have the first and immediate round of knowledge about them, and we have made prompt advices. For the makeshift hospitals and designated hospitals, we have developed specialized plans for their medical treatment and especially the mental crisis intervention. For the medical teams located at the designated hospitals and makeshift hospitals, we will give them distant guidelines and also the technical support. Gradually, we have improved the whole system of the mental assistance. For the designated hospitals, for the medics, we have created a very friendly environment and also play the video for the knowledge spreading and also help them to relax themselves. And we also offer a solution of music-based assistance, and also some other courses for them to take a break out of this heavily charged schedule, and our medics in this environment could also cheer each other up. And second, we also have this mutual aid program. We have extended the scope of the psychological crisis intervention. We have the tutors to help the medics, especially the nurses. We give them the key knowledge about the psychological crisis intervention, and also the utilization of mental health platform online. Every day, the nurses will help the patients. At the same time, they are also keeping an eye on the mental status of the patients, so that once there's a mental problem at early stage, they can have an early discovery of that. We also have the online video conference and lectures. We have organized many rounds of expert lectures online. We have also developed online systems supported by the latest technology to give the mental assistance to the people in need. On the basis of that, we also designed a lot of measures for the psychological crisis. For example, the relaxing methods and other methodologies. And also we give training opportunities to our medics so that they can take care of the physical and mental health at the same time for the patients. And third, we have coordinated the efforts of the 8 teams of medics coming from other provinces. On the 20th of February and on the 23rd of February, we have received 2 batches of medics, in total 305 people coming from other provinces to help our province. We have established an association composed of all the colleagues working in this area of psychological crisis intervention. We have set up the volunteer teams and also the Red Cross volunteers teams, as well as other workforces for the mental health. For example, at the provincial level, the Red Cross Association have organized the volunteers and also other community-based workers to give more support to the ordinary people in the society. In the society, we are also helping to people to get more access to the knowledge necessary for their mental health. And we have opened a hotline in all the prefectures and also the cities in Hubei Province, at least one hotline for mental health and the psychological assistance for each municipality or prefecture. We also have a timely feedback basis with which we can improve the quality of our services. The Mental Health Center of Hubei has also established a platform for the mental assistance to give the mental health assistance to the communities in the province. We also have the one-button emergency call service given to the people. And next is that we have given to people more knowledge about the mental science. In designated hospitals, makeshift hospitals, and relevant authorities, we have made the booklets and also other brochures so that people can have the fastest access to those important knowledge. And also in the media, for example, the Yangtze River Journal and other newspaper and magazine, we have published the papers, and also in the radio and the TV system, we have the programs broadcasted. And currently online, we have also made a promotion of the information and published works in collaboration with the Hubei TV and other media, so that finally we can win this critical battle against the COVID-19 in the mental health aspect. We have also elaborated other booklets and brochures to help people to stay vigilant against the mental impact of the COVID-19. And fifth, we have strengthened our efforts in following the mental status of the patients, especially those in critical and severe conditions. For the designated hospitals and makeshift hospitals, we have coordinated all the efforts so that we can have a synergy in the monitoring of all the patients suffering from the mental problems. We have also the cloud-based medical services and the online consultation services. We have the online mental assistance platform to give our helping hand to those COVID-19 patients suffering from the mental problems. And for the municipalities and prefectures, we give them self-service booklets and brochures as many as 100,000 and another 35,000 information brochures. At the local level, for other prefectures and cities, we have set up the mental assistance leading groups at each hospital. We have also opened the hotline to help people, and also the questionnaires for people to collect necessary information about the patients in Yichang, Jinzhou, Huanggang, and several other cities. They have also carried out the mental assistance program in the designated hospitals. Sometimes there's even joint consultation among the scholars and doctors. Now the floor is open for your question. Please first identify yourself. I'm from Guangming Daily. Currently, the status quo has been stabilized. What is the focus in the mental assistance for the patients discharged and also for the relatives in their family? What are the major mental problems and what are the solutions for that? I'd like to give the floor to Mr. Liu Zhongchun. Thank you for your question. Because we have consolidated the achievements in the response against the COVID-19, so we are also making a dynamic evolution of our mental assistance. Currently, the focus has been moved out from the designated hospitals, makeshift hospitals, and other major treating authorities to the communities. And currently, we are paying more attention to other key groups, for example, people working at the grassroots and also working in a community. So that means it's a larger scale of people. And also, we are encouraging the ordinary people to increase their own capability to fight against the possible mental risks. For example, they may suffer from the depression and other mental problems. So in our intervention, we have, first of all, the need to raise people's awareness about the possible mental risks. For the discharged patients, they may suffer from the discriminatory difficult problems in the society. And we encourage the other people in the neighborhood to show a friendly attitude to those discharged patients. After the discharge, the people cured and discharged should make sure that they have enough nutritious food and they can always take a good rest, and also add up some necessary exercises. We also guide those discharged patients and their relatives to change their mentality and let them make sure that all those discriminatory problems they encounter in the society, they're just temporary challenges, and with time, all would get better. And they have to keep the focus in their own lives and also in their work resumption. During our consultation and the treatment procedure, we have to give them more encouragements so that they can pick up again their confidence. If we want to help those people, we have several possible channels. If you think you need help, you can always stay in contact with us through this hotline, and you also can seek professional psychological consultations. Next question, please. I'm from China Daily. We know that currently you only have double-digit people receiving treatment in the hospital, so that means most of the patients are cured and discharged. Why it is necessary to have this following up treatment in the mental aspect? Thank you for your question. For the COVID-19, we have several stages. First is the diagnosis, and second, the treatment, and third is the cure and discharge. We'd like to restore the whole functions of the body of the patient. Even after being discharged, they may still suffer from some following up symptoms, for example, weakness and also the mental risks. And even after being discharged, sometimes they may run into some following up difficulties. For example, temporarily they may feel some problems or difficulties in the breathing system. So in order to remove all those secondary effects and following up negative effects, we have to continue to monitor the status of the patient and to get them into exercises. For example, help them out with some physical exercises, like to do some sports that are good for their respiratory system. By doing so, we can help them in restoring their resilience against all those weakness following up the treatment. We also use the acupuncture, TCM, and also some other heating methodologies in the traditional Chinese medicine to further prepare their body for that post-treatment period. We also have some good advices for them from the traditional Chinese cures, for example, the Tai Chi and the Ba Duan Jing. And we also have other proposals for them. For example, it's important to relax themselves mentally. All those other measures would help them to get back to the normal status as soon as possible. Next question, please. I'm from Hubei Daily. Currently in Hubei, we have been classified as a low-risk area, so we have achieved a good result in our response against the COVID-19. On current basis, how could we have a long-term mental intervention? After the outbreak of the COVID-19, we have included the psychological crisis intervention into the treatment of the COVID-19 and also the after-treatment period. Today, after this outbreak of a major public health emergency event, we have added up more importance to the psychological treatment. First of all, we will set up an important mechanism under the leadership of the CPC and also catching up with the measures of the financial department and the other relevant government authorities. At the same time, we're also in collaboration with the Association of the Women and other organizations. We are organizing the grassroots organizations and important hospitals, as well as the third party that can help us, even with the organizations from the society and the community-based organizations, to set up the whole network of the psychological assistance. We'd like to have a team for psychological help that is localized and is down to earth, which can provide practical support to our people and give the best service to our people in the psychological aspect. Second, we should make some innovations. We have to give more trainings to our psychological consultation professionals, and also online we have the platforms for the consultations and treatment, and we have opened the hotlines for people's consultation. This together would form a whole system of the psychological assistance. We have to assemble all the necessary and available resources, and under the unified leadership of the upper authority, we can carry out our efforts and our work in a standardized way. We also have to protect the legitimate rights and interests of those discharged patients as well as their relatives. For example, protect their personal individual secrecy. I'm from Changjiang Commercial Daily. For those discharged COVID-19 cases, what are the possible ways for the post-treatment recovery, and what are the important key points for their recovery period? To Mr. Xia Wenguang, thank you for your question. There are several ways of the recovery period: inpatient, outpatient, and recovery at home. If they are suffering from multiple problems, they have to go to a professional recovery institution. This can be outpatient service or inpatient service. After following a professional consultation, they can take up gradual and tailored solution for their recovery period. This can help them to pick up their normal function of the body and get back to the normal life as soon as possible. We will put the focus on their physical health and mental health at the same time. If they only have very light symptoms, so they can choose to have the recovery at at community level or at home level. For the necessary sports, we can let the patients to choose according to their own taste and preferences, which suit them best. When we develop a physical exercises plan for the patient, we have to fully consider their capacity before the infection and also their own physical strength. We could refer to the COVID-19 Prevention and Control Headquarters announcement combining the TCM, the Western medicine. We can also refer to the document published on the 6th of April, which is about the guideline of using both TCM and Western medicine to cure our patients. We have to pay attention to the 5 following aspects. First of all, before the recovery, we have to check the temperature and also ask the patient to fill in the questionnaire so that we can have the full picture of the respiratory status and the normal capacity of living as well as their capacity of rejoining the society, to see the severity of their condition, which all those information could serve as the proof and also the underpinnings for our future methodology of the recovery. For those people that have comorbidity and people that are of old age, we have to keep an eye on their development of their health status and have gradual readjustment to the solution. We can also add up some oxygen-assisted solution. During the procedure, we have to pay attention to the hygiene of our hands. And during the recovery, we have to make sure that there's no excessive gathering of the people, and the disinfection of the environment for the recovery is also quite necessary. During the recovery, you should not go to very harsh sports exercises. Only light sports will do. The last question for the day. I'm from Chutian Capital Journal. There are more and more discharged and cured patients getting back to their life and society, but other people in the community, they still have some concerns. They are wondering whether those discharged patients can still be infectious to some extent. To Mr. Cheng Zhenshun, thank you for your question. First of all, let's look at the standard of discharge of the patients. There are 4 of them. First, normal temperature for at least 3 days. Second, good recovery of major symptoms. And third, for the screening of their lungs, significant recovery of those attacked areas. And fourth, the negative results of the nucleic acid test for several rounds, and between every 2 rounds of tests, at least 24 hours of waiting time. So those people that have the false negative, we have already a new standard for the discharge. For those people that have a false negative, they have to wait another 14 days as quarantine. Otherwise, they would suffer from longer period of staying at home quarantine. So this is like we are adding up another guarantee to the standard of the discharge. Currently, according to our medical observation, those cured and discharged patients are no longer infectious. It's safe to let them back to their home and to the society. For people, other people, healthy people in the society, you have to respect their rights and interests and show care and have a friendly attitude to those people. That is the end for today's press conference.